Welcome back to In Focus Kentucky. On this episode, we're discussing the new cigarette tax law passed recently and the overall status of health in our state. About 24% of Kentuckians are classified as smokers, which ranks second to last out of American states. And to help curb this issue, a 50-cent increase in cigarette tax bill was passed, and that will come into effect on July the 1st. And joining me now to discuss the law is Ben Chandler, Executive Director of the Foundation for a Healthy Kentucky. Thanks so much for joining us here on
Good to be here with you, Mario, and we're working real hard to try to deal with this smoking issue because it's related to so many unfortunate health circumstances. The top of the list is cancer. We actually lead the entire country in cancer here in Kentucky. We have the highest cancer rate, and a full 1/3 of those cancers can be attributable to smoking. So what that tells you is that 1/3 of our cancers in Kentucky are preventable. And what we want to do is we want to get people to try to work on preventing coming down with cancer, and one of the best ways to do it is to curb the smoking rate.
And I know that you recently spoke about Whitley County, where the adult smoking rate is double the national average, and cancer is also a big issue there. So explain to us what's going on there down in Whitley County.
Well, Whitley County is really not dissimilar from most counties in southeastern Kentucky. In fact, in January of last year, the Journal of the American Medical Association came out with a report that showed that cancer mortality in the United States of America had declined by 20% since 1980, except in Kentucky.
And explain to us about the Smoke Free Tomorrow campaign. It launched last year, back in October. So what was the reasoning behind that?
Well, we have, the reason behind it is this cancer rate. We want to do something about the cancer rate, and this is actually a good solution. Obviously, it's not a panacea, it's not the only solution, but it can have an effect. It can lower the smoking rate and lower the cancer rate, and it can do that without the taxpayers having to pay a single dime. Now, there are very few things you can say that about, but if we pass these smoke-free laws, Lexington has one, Louisville has one, but in Kentucky, out of 120 counties, only 5 of them have comprehensive smoke-free laws. If we can get those laws passed throughout the state, it would be a tremendous thing for Kentucky. Our coalition has come together. We've got over 160 members, including the Kentucky Medical Association, the Kentucky Hospital Association, the Kentucky Chamber of Commerce is even a full partner in trying to do something about this. We think we can make big inroads, and that's what we're going to try to do.
Now, explain to us about the vaping and e-cigarettes and how that plays into this whole conversation.
Well, vaping is a concern of ours because it has been shown to be a gateway, essentially, a gateway to the use of tobacco products. And we don't really know, without the FDA looking very closely at the products, what's in the vaping solutions, the liquid that's used. Then you breathe that into your lungs. We don't know what kind of harm that might cause. We think that it's probably a good thing if you limit what goes into your lungs to oxygen. We think that's probably healthier than anything. But vaping is, we think it needs to be curbed. We're seeing a high rate of young people vape, and we're seeing a very high rate of those young people starting on tobacco products. That leads to poor health, and that's why we have a problem with it.
And is it healthier than cigarette use?
Well, we don't know. There are some people who think it is, but we don't have, the FDA has not passed on that. And it's probably not a good idea to inhale or ingest products that are not FDA approved as a general matter.
Now, speaking of tobacco products, I know earlier this year you had an announcement with the Lexington Legends and about tobacco-free ballparks at that ballpark, Whitaker Bank Ballpark, but also city ballparks.
Well, we really appreciate Andy Shea, who's the president of the Legends. It was really an initiative that he was very much involved in. The Legends pushed it, and we're talking about tobacco-free entirely, not just smoke-free, but other uses of tobacco, and it isn't limited to just the Legends Stadium. It's in all ballparks throughout the city of Lexington, thanks to the mayor. So we're very pleased to have that happen, and we hope we see some benefits from it.
And switching gears as we continue the conversation about the status of health in Kentucky, I know a recent announcement was made about Medicaid waivers here in our state of Kentucky, and the foundation was a part of that big announcement that happened here in Kentucky. So talk to us about this new initiative and that's going to be happening here in our state.
Well, the governor, as I think most people know, has instituted a waiver here in Kentucky, asked the federal government for a waiver which would put certain requirements on Medicaid recipients. Those requirements include paying premiums and work requirements if you're going to receive your Medicaid. It's a whole lot more complicated than that, but that's generally what it amounts to. And there have been some predictions that almost 100,000 Kentuckians will lose their health coverage as a result of this undertaking. Now, we as a foundation have partnered with the governor, and we appreciate the governor's attitude on this. We have partnered with the governor to try to make sure that those recipients meet those requirements and that they don't lose their coverage. That's our goal. We want to keep people from losing their coverage here in Kentucky. And again, it's very simple. From our foundation's point of view, we want people to be healthier in Kentucky. We believe that if they have health care coverage, they have a better chance of good health. And that's what we're trying to foster.
Well, Ben, thanks so much for making time to join us here on InFocus Kentucky and talking about the work that your organization is doing on this major conversation points for us.
Well, it's a pleasure, Mario. Thanks for having me.
Absolutely. Now, coming up, we'll speak with the first female chair of the World Medical Association to discuss different health issues around the state. Stick with us. You're watching InFocus Kentucky.